Hi viewers, I'm Dr. Ruchira, dental surgeon at Eledent. We are located in KPHP and in Kondapur. Today I'm going to speak to you the 3 W's of implant, which are what is an implant, why an implant and where an implant. So when I say what is an implant, implant is nothing but a titanium screw. This screw, which is very biocompatible to the bone. That is why we try to place an implant which is made of titanium, and pretty much why it can also be a little expensive. So this is an implant. Now let me tell you, why do you prefer an implant over say a bridge or something. So usually when you have missing teeth, or you say one tooth is not present anywhere, or you have multiple missing teeth, or you do not have any teeth present, usually people or dentists give you 2 options saying go for a bridge or go for an implant. But what I feel personally is a very big disadvantage when you go with a bridge. What happens is when we try to do a bridge, we try to make sure that we are trying to take support of 2 adjacent teeth. So basically we are trying to form a pillar to give a new tooth. So basically taking support and giving you a tooth. What happens in this process is we end up grinding 2 more teeth to give you a missing tooth present. So next, now I'm going to tell you why do you have to place an implant. Usually implant is something which is related only in the area where you have a missing tooth, or say in an area where there are no teeth present or you do not have any teeth present. Why I prefer an implant over a bridge any day is because when you are trying to place a bridge, you are not only trying to fill the gap where there is no tooth, but also you are touching the teeth present next to it, because of which in future or any time in coming future you tend to have a cavity, or not say cavity, or say you have decay, or even if you are having any gum infection in the tooth which has been used to make a bridge, they tend to spoil and you might have to end up going with a new bridge altogether. This not only is very harmful, but also it causes a lot of different issues, like say in future if it breaks off, you tend to have a fracture in the bridge, or also there are some times where if you are trying to try to chew too much, you tend to break it off and things like that. So in situations like that, I prefer to go with an implant. Implant is nothing but where you place it only in the jawbone. So this is where when we place an implant, or where do we have to exactly place an implant, it is usually present, we place it in the jawbone. Implant usually has a screw and a cap. So the cap is nothing but a crown. This is where we place it in the jaw. And what happens is once we place this implant, we let it be there for a couple of months, say 2 to 3 months. Usually implant, you have it in 2 procedures. Either you do immediate extraction with implant, or you do an implant after your tooth has been extracted, and the extraction period has been from the day till the day you want to place an implant has to be minimum of 3 to 6 months. That is when I can place an implant. Or when I say we do immediate extraction with implant is in a situation where we have to take off your tooth, and in place of that we place an implant immediately. And after we place an implant, we usually take at least 2 to 3 months to give you the cap on the implant. And the reason why an implant is so beneficial or very useful is because this is very biocompatible, and what happens is it lets the bone form around this material, or say around the screw. Because of such a situation, what will happen is you tend to not damage any other tooth present around it, you do not have any major disadvantages, you do not have any pain or anything new present in your mouth. So if you have liked my video, please subscribe to the channel.